Okay, for this little bit, I want to talk about some nutrition strategies. It's important that people eat, that they eat the best possible diet they can, and of course, if people have no restrictions at all and they can eat just any food on the planet, that's great. Feed them. Nutrition is just an important part of healing. But more than likely, they'll have some issues that get in the way of them being able to eat. So I wanted to just throw out some tips for you that might be helpful when you're scratching your head wondering, what do I do now? One of the problems can be altered taste. We alluded to that earlier, and that is where food doesn't taste like itself, it tastes like something else. A classic complaint is that medications that people are on make everything have a metallic taste. So what do you do to camouflage that so they can get food in that it doesn't taste like they're eating the pan it was cooked in? And one strategy is to use that broth. Hospitals have it. It's a bouillon and it's powdered. You pour it in a cup of hot water and it's this chicken soup. The thing with it is it's very salty. So if they're on a salt-restricted diet, that's not going to be a real helpful one. But if they can use it, what you do is that's the beverage with their meal. And there's something about the saltiness that cuts that taste on their taste buds so that food can go by and it minimizes the metallic taste associated with the food. So you can use that. Another thing that can be used that has a bite to it is cranberry juice. And they take a sip of that and then shovel in their food and then another sip when it wears off. And that can be a strategy for teaching them how to get down a meal. Another thing that happens, and it's not necessarily just a function of aging. We said that people lose taste buds. That's true, they do. But a lot of times they're mineral deficient. And if we do not have enough zinc, then nothing tastes like anything. And you'll notice, a lot of times people don't complain of anything, but you'll notice that they're constantly salting and peppering and looking for ways to flavor up the food. And you kind of are looking at them and go, why you put so much salt on that? And well, nothing tastes like anything. Multivitamin with minerals, and the minerals have to include zinc. And once their zinc stores come back up, food will begin to taste better again. So that's a little tip on that one. Then there's lack of appetite. They just don't feel hungry. One of the first things I always look at is, what is their medication schedule? Do they have lots of pills that they're taking lots of times during the day? And of course, every time you're giving someone medicine, you're giving them this big, huge glass of water. And if you think about it, taking water before you eat's been a diet strategy for a long time. Fill up the stomach, and then people don't have a capacity to overeat with a lot of food. Well, if we're filling their stomachs with water and a bunch of pills, maybe we're sabotaging the nutrition under the medicine regimen. So it might be that brown bag review. Look, we got so much going on here, they don't even have room to eat, much less their time schedule. And revising everything so food can be fit into the schedule along with their medicine. There's another phenomenon that happens, and it's just a function of whatever illness they're living with. Sometimes it can be depression. They just don't have an interest in anything, and so food is one of those things they lose interest in. Or for some reason, the metabolic process that they're going through, particularly if they've been wasting for some reason, on an incredibly rapid weight loss decline, the breakdown of their own muscle in their body has released chemicals in their bloodstream that's giving the brain the message that they're full. So it's a flawed message. And the best way you can reverse the message is to get people eating again and change this balance of these chemicals. And there are appetite enhancers that people can take. Meg-ACE is one of them. It's an estrogen-related hormone that makes people ravenously hungry. All of us girls can probably remember times when we've been ravenously hungry at the peak of estrogen production. Well, it works really well. There's also marijuana is another one. People who have had a history of ever smoking pot, the munchies have their place. Now, that doesn't mean we need to be sending people out to procure, ounces of pot for people. But if that's something that people have done, because we're getting into a bunch of old hippies that might be cycling into old age, that can enhance appetite. The active ingredient in marijuana, THC, is encapsulated in something called marinol that can have a twofold effect of reducing nausea and stimulating appetite. So it may be putting them on marinol. If they're on prednisone for any reason, they will eat a hole through the refrigerator door to get to food. And they'll be crabby while they're doing it. So just know that prednisone is PMS in a bottle, so get ready to deal with them if they're on prednisone for any length of time, but it will make them hungry. The key is, if anybody's on an appetite stimulant, have food available for them. There is nothing more awful than being very hungry and you're incapacitated and can't get in the kitchen to get anything. So if they're on these things, the food needs to be where they can get to it, and lots of it. Some people develop, if they have something going on with their gut, the stomach or the intestine, they can develop a fat intolerance. For some reason, fatty foods are not broken down well. And what this will mean is they will get nauseated, they will have lots of gas, they will be bloated, not feel very well, and kind of the way you can tell whether it's a fat intolerance is when they have a bowel movement. If before they flush it, you look at it and there's this kind of oil slick on the toilet, all their fat is going right on through. Now, the implications of that are there are certain vitamins that we only get because it dissolves in the fat that we absorb through our food. Things like A and E and D and some very important vitamins that we need for lots of health. And if they have a fat intolerance, those vitamins are going out and they'll get vitamin depleted. So it's important that that gets reported so that they can, number one, be put on a low-fat diet so that other nutrients will get absorbed and the irritation of the bowel dealing with this fat won't be rejecting everything, because that's kind of what happens. But there are certain kind of specially formulated oils that the doctor would then prescribe that would be added to their diet that they could digest that will allow them to get their fat-soluble vitamins and not get into a vitamin crisis. Then the other thing that causes a similar symptom group is a lactose intolerance. And that is people who really cannot break down milk sugar. A lot of dairy in our culture. It's a staple. There's about 35% of the people in the United States who are lactose intolerant because genetically where their people came from originally, they didn't have dairy. Lots of African Americans, some Asian Americans, some Hispanic Americans. They just don't have the genetic makeup to break down milk sugar. And it gives the same variety of symptoms: bloating, nausea, lots of gas, very uncomfortable. And they'll tend to know because they'll eat any dairy product and they'll be not feeling good. So you can either eliminate dairy and go to the non-dairy creamers and soy-based kinds of things for part of their diet, or you get the lactate that gives, they take the enzyme to break down the sugar when they eat dairy. But those are some of the things you can do to deal with the lactose intolerance. Low sodium diet, well, that just means more than just table salt. There is sodium so infused everywhere in our food. Become a label reader. You will be mind blown at all of the places and the sodium compounds that are preservatives that are in just about everything that is boxed or packaged or given to us to consume. And people on sodium-restricted diets really have to pay attention to those labels. Hopefully, when someone's on a sodium-restricted diet, there has been a dietitian who has given them the paper that says, you know, what a low-sodium diet is and some meal planning, because they're only going to be allowed 1 or 2 grams of total sodium per day. Otherwise, with sodium, they hold water, and they're probably dealing with some heart problem or some kidney problem, and they really need to not have extra sodium. Sometimes it's as simple as you can eat anything you want, just don't pour salt on it. And for a lot of people, that's great. But if you have people in the home who are cooking for someone, the sodium restriction thing becomes, you know, something that they have to pay attention to. And if they don't have to adhere to it at home, they've got to change all of their thinking about how they're cooking for this other person. And how they're shopping for them. Diabetic diets, Nothing more to say except the person should have the prescribed diet listed there, and that should be providing the guideline for how they eat and how people shop for them, and make lists. Kidney. That's the most complicated one. And all I'm going to say is if somebody is on dialysis or is dealing with renal failure, they need to, a dietitian has to have made that diet listed and taught them. It's the hardest diet to work with because you can't have all these things over here and they want you to have this over here, but it has some of this over here in it. And so you can only have this much of this so you don't get too much of this. And it is all over the map, you know. If I ever have renal disease, I think I would just climb into a warm tub and open a vein because I don't know how I would feed myself. It's very complicated. And the other one thing about kidney diets is they are very low protein because the kidneys, high protein, they have to filter protein, and if they're not working, it really can further destroy them or further damage them to have protein. People with dental problems, okay? Their own teeth are bad, which make chewing and swallowing difficult, might be painful, so people don't eat, or they need soft foods, or they need stuff that's fairly liquid, or they've got new dentures. They got old dentures, and they're sores, or they've lost weight and their dentures don't fit anymore. Do a little troubleshooting if someone seems to be avoiding eating, or you notice that they only go for the Jell-O and you know, they won't eat a piece of toast anymore. What's going on? You know, does your mouth hurt? When was the last time your teeth were checked? Do your dentures need to be refitted and, you know, pads put in them? Or, you know, maybe their dentures fall, they don't fit right, so they don't stick where they're supposed to be, so they're chewing and their dentures are falling. And you can go to the grocery store and buy Stick-'em, and you coat the dentures and glue them into their mouth. But people need to be seeing a dentist, and that can affect whether they eat. The other thing that can happen is the mouth dries out. Salivary glands decrease in the amount of saliva production over time anyway. But then you get these medicines that just dry you up, and it's like cotton mouth. And you'll notice when people talk how, you know, they'll have this dry mouth sound. Lots of liquids. You know, they need to be probably drinking water all the time because the meds are depleting them, unless they're on a fluid restriction, and then that's another whole bucket of worms. But when they're eating damp food, things with gravies, things with sauces, lots of liquids with the meal, because saliva is what moistens the food so that we can swallow it. It's the first step in digestion. And go ahead and someday when you got a real dry mouth, put a cracker in there and just see how great that goes down. You know, you'll be chewing that cracker for about an hour, and then finally you'll just spit it out. So, you know, think about making food that's soupy, you know, but not giving them just soup, but just moist food and lots of liquids with their meal. Another thing, if someone is having a dry mouth problem, their oral care products should not have alcohol in them. So, and there is a whole line of therapeutic products you can buy at any drugstore that are non-alcohol-based mouthwashes, non-alcohol-based toothpastes that really, you know, that's what they're for, is people with saliva production problems. One of the other things you can do to stimulate an appetite is use smells. You know, what we eat is really tied to how we smell things. Hot food smells more than cold food. The inverse is if smells make people nauseated, you go to giving them colder food because it doesn't have much odor. And if you want them to drink stuff but all the smells seem to irritate them, give it to them in a covered cup with a straw in it. You may want to, you know, save some of those 99-cent specials in the drive-thru with the lid on them and the straw punch hole in them. Because that may be the only way people can get some like hot soups or stuff down so that they don't smell them. And another thing is if people are getting like Meals on Wheels or any covered food that's coming in little closed containers that's hot, take it somewhere, take the lid off of it first, air it out, and then bring it to the person. Because all of those congealed smells under there, which is usually something like broccoli and fish and, you know, some of the things that smell the best that we all love very much. And that's all congealed under one warm lid, and you take that lid off and it all goes up somebody's nose, and you had them all primed for eating, and then all of a sudden it's like, no way. So think about how things smell to whether stimulate an appetite, or if you don't want them to eat it, just pull it right off under their nose and that's your lunch. And then I want to put in a little bit of a pitch for nutritional supplements. You know, those wonderful, specially formulated things in a can that they now advertise as being, you know, what anybody over 50 should be eating 3 times a day, according to the TV commercials. They have their place. They can be very important. You know, we talked about that kidney diet, that's the diet from hell. Well, the companies who make nutritional supplements actually make specialty supplements for different disease conditions. There's some for people with pulmonary problems. There are special kidney formulations, liver for people that are suffering with chronic hepatitis and cirrhosis. They're not readily available at the drugstore, but if you went in and told the pharmacist, you know, we can't feed this person, they will order that stuff special. So know that that's available if they're just not eating food. You know, you can't get anything else down them, but you could get a 250 cc can of something down them 3 or 4 times a day. So they do have their place. What I used to find that I had to do with nutritional supplements was I had to doctor them up a little. And here I'm going to put in my plug for Vanilla Boost. Frozen Vanilla Boost makes the best ice cream I have ever tasted. Honest to God, it makes a killer vanilla ice cream. So you pour it out, you freeze it, throw a lump of it into a thing and pour some root beer over it. It's a killer root beer float. Now you can't boil these things, but you can chill them and freeze them. And you can heat them up a little bit. But you got to think out of the box with these things to make them palatable to someone. They can be blended with any number of fruits. I think I gave you a ton of recipes for blending and mixing and doing things with nutritional supplements, aside from just popping the top on a can and plunking it in front of somebody. My experience with that is I picked up a whole lot of cans at the end of the day that hadn't been touched. So, cooking with nutritional supplements, consider it if you're really genuinely concerned that someone is not eating well. Let's talk first about universal precautions, and that's just infection control in the home. And we used to have a very elaborate form of infection control where we categorized different diseases by their route of contagion, and then we did these precautions around that particular disease. And then somebody, in one moment of infinite wisdom, said, look it, why don't we just approach people assuming that they have a contagious disease, and we just do these same precautions that prevent the spread of illness from person to person, instead of stigmatizing people by, you know, you have this horrible disease and yours is slightly less horrible and you can really kill a lot of people if we deal with you. And what we really need to do is just treat people like they have something contagious and we're taking steps not to spread that illness. So I wanted to give a few minutes to home safety and some strategies. And the first and foremost and best way to prevent the spread of infection, and I mean bacterial or viral or anything, is washing the hands. Single most important thing that you ever do. Before you ever go to anybody's home, wash your hands. Or the first thing you do when you walk in the door is you go wash your hands. And then the last thing you do when you leave is you wash your hands. And in between, you might find you're washing your hands a whole lot. And we're talking about people who I said earlier, you know, are probably in some form of immune compromise, just age, diminishing immune system. So this is as much about protecting them from getting something from us as it is about protecting us from getting something from them, okay? Because we're bringing stuff in from the outside. And all our colds and our flus and whatever our kids are bringing home from school, from their friends, and you know how that all gets shared. So hand washing. And most people's homes have a place where you can get the water good and warm, and you can really get up a lather, and it's not the soap as much as the friction of spending some time over that sink, rubbing your hands together and really getting in between the webs of the fingers, and really spending 1 or 2 minutes, because that loosens the dirt. Then the soap actually damages the cell wall of the bacteria and the virus, and then you rinse it down the sink and inactivate those things, and then you're not spreading colds and flu and other things through the house with the things you touch that they touch behind you. Most colds are spread by these, not airborne. So it's wash your hands. I'm a big fan of pump soaps as opposed to bar soap, because every time the soap comes out of this dispenser, it hasn't been touched by anybody else. It's clean soap. And if you've ever gone to one of those roadside gas station bathrooms on a trip, little bar of soap sitting there, and it's got cracks in it and all these black lines in the cracks, that's not because it's black middle soap. It's growing cooties on it, okay? So, I'm a big fan of your basic pump soap, and I'm not a big fan of antibacterial soap. You don't need antibacterial soap. And I kind of am fond of Dove soap. Dermatologists say, I mean, if your hands are going to be washed a lot, this at least has some cold cream in it that doesn't strip your hands of the essential oils you need, which also are part of protecting your skin. And you don't need to use something on your hands that's going to strip it down to where then you get little skin cracks, because that further breaks down the integrity of your skin to prevent infection. But a good pump soap. Now, Dove, unfortunately, does not put their soap in these cute little containers anymore. So you might want to buy some nice little cheap pump container and then use the Dove thing to keep filling it. But pump soap is the bottom line. If they don't have a good bathroom somewhere, this is some of this antibacterial waterless hand cleaner. I keep a little thing of this in my purse all the time, because there's sometimes you go places and there's just not soap and water and towels available. And I swear to God, I think this stuff has helped me from getting some kind of disease from riding Muni all the time. I always use this before I go out and get on the bus, and I think it's killing cooties all the way until I get home, as I'm handling bars and grabbing on for dear life so I don't fall over. So, now, the other question is, when do we wear gloves and when don't we wear gloves? Well, there is a rule of thumb. If it's icky, wear gloves. And I think you can figure out icky, okay? Any body fluid, I determine is icky. So, just disposable latex gloves. Now, sometimes people think they're being real economical. I'll put on these gloves, and I'll use them 2 or 3 times, and then we won't have to buy so many gloves. Pay for the gloves. You use them to dispose of or clean up after body fluid spills. You toss them, and you get new gloves. You know, and somebody can go to Costco, they can get big boxes of real discount gloves. These are really important. Body fluid spills, if it's icky, you wear gloves. Now, household cleaning. You don't need anything wazoo, high-tech, super germ killer. Good old bleach, and it doesn't even have to be the brand name. Generic chlorine bleach. 1 part bleach, 9 parts water. In all my caregiving experiences, we just got those 3 packs of spray pump bottles, and we made up our bleach solution, and one was in the bathroom, one was in at the bedside, and another one was kept in the kitchen, and we used bleach for our general cleaning. And worked real well. It's very inexpensive, and it's a really effective antibacterial, antimicrobial. Now, when you're cleaning up things and you've mopped floors or whatever, you dispose of dirty water down the toilet. You don't take the floor cleaning water or whatever and dump it down the kitchen sink. Not okay. Goes down the toilet. If you're taking them to the doctor and they have to bring in a specimen, obviously that's going to be, you don't know what they did when they were in collecting that specimen, so you wear gloves, you handle the specimen, you put it in a little Ziploc bag, put that in a brown paper bag, throw away your gloves and tote the specimen off and turn it in to the doctor. That's the way to do that. And people who are home on insulin should have a biohazardous waste container for their insulin syringes. And one of the things that we tell people is you don't recap syringes once you've used them. The biggest reason people ever get needle sticks in the home is because they pick up a syringe, they pick up the cap, and they attempt to cover that needle before they dispose of it. You don't do that anymore. You just, once that cap has come off, toss it, and the needle goes straight away into the bioreceptacle. Because even though your people may not be administering injections, which obviously they can't, but they're cleaning up afterwards and they think they're going to do the right thing and put the cap back on the needle. Just throw it. Now, if the person doesn't have a biohazardous waste container, get a 2-pound coffee can. You can throw the needles in there for a while, the needles and syringes, and then fill it up when it gets about half full. Just pour plaster of Paris in there until it's all covered. It gets hard. Put the cap on the coffee can and then toss it in the garbage can. That's another way to dispose of the needles and syringes in the home. Finally, about when, we just talked about washing your hands, but you got to dry your hands. My particular bias is that when I'm in somebody's home, the patient has their linen that only they use. When we took care of Miguel, we set up a paper towel dispenser in the bathroom and a paper towel dispenser in the kitchen. Miguel used all the linen. We used the paper towels for drying our hands and doing those kinds of things. I've known of other households where the identified patient, all of his linen was one color. He had all the white linen, and everybody knew that if it was colored linen, they could use it. But white linen was definitely the identified patient's. And that way, you're handling something, you don't inadvertently contaminate the linen that they're going to wipe their face with or something later. So it's just a way to keep things clean in the home. Now let's see. I know I've got something else under here. Okay, we've got a few food safety issues. Obviously, we're washing those hands again. I'm real big on this one. Very, very important. Keeping things clean, your bleach solution. Paying attention to expiration dates on foods and over-the-counter medicines. People get delicate. Food poisoning becomes an increasing risk for things that aren't stored properly, things that aren't cooked properly, and making sure that the dairy products that they're using are pasteurized. Storing food, do what it takes, cook things thoroughly, and refrigerate. Have 2 sponges. One that you use on dishes, separate from whatever's used for cleaning. And it's not a bad idea that when you run a white load of wash that you put a little bleach in, toss the sponges in and run those through a bleach wash fairly regularly. Because sponges in the kitchen, with wiping up food spills can actually become the cause for food poisoning contamination. So run them through the wash once in a while. And that really does not apply to this. So any questions about food safety or? Okay, so let's strategize some symptom management here. All right. You might want to keep track of people. And I told you I was going to show you a calendar. Well, we have a calendar here. And the great thing about keeping track of things on the calendar is that it's on the wall. Anybody coming in and out can kind of see what's gone on, what's expected to happen. All these red things here are appointments of some sort or another. All of the blue stuff is, monitoring someone's ongoing weight or vital signs that we need to know about. And the black are different symptoms that we're tracking and following. And what happens with this is you're ready to go to the doctor's appointment. You just pull this off the wall and take it with you. And the doctor says, what's been going on at home? And you can go, here, this is what's been going on at home. And it makes it real easy, and you don't have to sit there with the 15-minute visit and try and figure out what's the important stuff here, what's been going on, because you're a rattled wreck and you don't remember it all. And so the calendar can be real helpful. Obviously, to know whether something's wrong with somebody, you got to know that what their vital signs are deviates from their baseline. So we got to know what's normal for somebody. Weighing people regularly is important. And I don't care that it's a really good scale, just so that they're weighed on the same scale, wearing about the same clothes every time, about the same time of day. And what you're tracking here is either weight gain or weight loss trends. Now, someone with congestive heart failure who gains 5 pounds in 48 hours, that's significant. They're holding water. So they'll either be in some sort of pulmonary edema or big old fat feet and in a crisis. So weighing people regularly can be important. And just reporting they're losing or, God, they've gained really fast. You won't be checking pulse rates necessarily, but the idea that somewhere it's recorded what's a person's norm. What are they when they're not sick? What's their respiratory rate? What's their temperature? What do you think a normal temperature is? Well, it can be for you. Is that what yours runs? Okay, everybody thinks it's around 98. We were taught in nursing school 98.6, and I worked for 20-something years in nursing, and I ran into one person that had a baseline temperature of 98.6. Everybody, I mean, it was 96.9s. I had a whole bunch of 97s, 1 or 2 99s. So you got to take somebody's temperature once in a while. People need to have a thermometer. I'm real big on the little digital jobs. You know, they're pretty inexpensive. They're fairly accurate. Just having one around and every now and then taking somebody's temperature, write it down. Know what their norm is. And no, we don't do rectal temperatures anymore, okay? That doesn't need to happen. And if they can't do an oral temperature, you take their temperature under their arm. Okay?
What do you think of the ear things that,
I think they work great, but they're just really expensive. Most people don't have them.
40, 50 bucks?
Yeah. And I think that that's, you know, if I have that kind of money, I'm spending it on a pair of shoes and I'm buying the $3 thermometer. You know, it's just my priorities. And the question was, what do you think about the ear thermometers? If I can't wear them on my feet, nah. And we ask people about pain. We inquire regularly, are you having any pain? That is now the 5th vital sign. It is a requirement if they are in the hospital or in a nursing home or whatever, that every time somebody comes in and does these other values on them, that they ask them if they're having pain, and then if they say yes, they are having pain, it is assessed and a pain control protocol is put into place. So if someone starts telling you they're having pain, report it. Okay, when someone has a fever, well, we don't like it when people have fevers, but what the heck, they do sometimes. Obviously, when you have a fever, it means that something's going on. It can be the onset of a new infection, but actually when people will also run fevers is when they're severely dehydrated. So you might have an idea that they've not been drinking well for a while. They've been losing fluid because they're having nausea, vomiting, diarrhea, sweats, whatever. You've got this fluid imbalance and they'll run fevers. So assessing their temperature, figuring out, you know, after they're chilling, you know, when they're done chilling, take their temperature. And then finding out the cause. It needs to be reported. They need to be gotten in and be seen by somebody. And then, of course, once they're done chilling, that means the temperature's up as high as it's going to go. And then you want to kind of get them cooled down. You want to take the covers off of them, light clothing, kind of let that heat go off of them. If they have something that they normally take for fever, like either Tylenol or aspirin or something like that, you can encourage them to go take one of their medicines to help, that would help bring the fever down. Ways to cool a fever is give them lots of liquids. That's really important. The other thing you can do once they're, you know, kind of warm is cool packs. And frozen peas make really wonderful ice packs. And they'll never melt and leak out the Ziploc bag. And they mold around places. You know, if you ever actually have an injury, like a bad knee or a low back, bunch of bags of frozen peas. But I really recommend that the ones you're using for ice packs, you put a big black X across so you don't inadvertently serve them to somebody for dinner. That's a really important thing to remember about frozen peas. I can't stand peas, so every pea in my freezer is a cold pack. There's no danger anybody will get my ice packs for dinner. A tepid sponge bath can be real helpful to bring off the heat and bring that temperature back down. What you want to do is have the water so that if you put your wrist in it, it just feels warm or you don't feel anything. You never put ice, ice baths or ice water on a person who has a fever. So tepid sponge bath, and then you just wring out the rag and just get them damp. And it's using the same phenomena of convection. If you think about you've been swimming on a hot day, you get out of the pool, a breeze goes by, and you feel cool. Sometimes you might even feel cold, even though it's 110 outside. And so the idea is that the water on their skin, when that breeze goes by, will help cool and deflect some of the heat and bring their skin temperature down. You can put a fan on in some part. You don't want a fan directly blowing on them, or you don't want them in the path of the open window in the wind. But if there can be some way that air is circulating in the room when you do the tepid bath, it will really help to take away some of the heat from the surface of their skin. And obviously light clothes and covers. And meanwhile, we're reporting this to the physician and getting a treatment plan to deal with the underlying cause taken care of. What else have we got here? Fatigue, big one. What's causing it? Well, the point is that it gets reported and worked up. Because if there's something that's definitely causing it, particularly if it's anemia, because anemia can be dealt with. There's medications they can give that can stimulate red blood cell production, and there's also iron if it's an iron deficiency because of their diet. Keeping some kind of a journal for a while to get a sense of what their daily pattern is. When is the times they have the most energy, and when are the times of the day they have the least amount of energy? Because that's going to guide you in planning. When do we do our outings? When do we try and schedule most of the appointments that demand most of their energy, the getting ready for, the getting to and from? And then when are the times of the day when we need to scale back what's done? And the times of day when they can't go anywhere might be the times when the services who come into the home are scheduled for. So it's doing some planning. And oddly enough, the antidote to fatigue is exercise. Now, we're not going to be signing these people up for the gym. They're not going to go to Gold's and pump iron. But there are a lot of ways that they can do things if they can't even get outside to take walks. I really recommend looking into the Sit and Stay Fit program. It's actually on TV, exercises they can do sitting in a chair, standing by a chair, in their own living room, exercises that bedbound people can do to stimulate large muscle movement. And that can help to produce the endorphins that they need to stimulate them to not be so tired. And obviously delegating. Who's on the team? Who does what? What are the things that this person now is too tired to do that need to be done? And of course, that's a lot of why your people are there. But when your people are gone, who else is going to be there to do these things? Okay, nausea, sick to your stomach. Most often happens as a side effect to medicine. So some of the things you can do, cold food as opposed to hot food, and definitely food odors can stimulate more nausea. Bland food as opposed to spicy. People tend to tolerate salty more than sweet. So all those little candy bars in the back of the room, until you're not nauseated anymore, can't have one. And then think about frequent small meals throughout the day as opposed to trying to do the the 3 squares a day. Another aid that I really like are called travel bracelets. Anybody ever use travel bracelets for motion sickness? Based on acupuncture theory. Okay, these 2 little elastic bands, there's a bead in them back here. And you put this on your wrist, and you have some tendons in your wrist right here. And you put this little bead in between the 2 of them. And for chemo patients, this is really great. They're laying in bed, and right about 10 minutes before they get up, we put these on them. And then when they get up and move around, they wear these, and it really does minimize the nausea that they feel. So people can wear these all day long. If they get travel sickness, they can wear these. It's not adding another pill, and it actually works on those pressure points to help reduce nausea. I got these at the drugstore where they sell the Dramamine. I've also seen them in some of those little catalogs for little gadgets and stuff that come in. Is there one, something Wright, Carol Wright catalog? She has all kinds of amazing little things. She sells these. They cost about $10. You can go to any travel store and get them. The other thing that Carol Wright has is this great little Lazy Susan that sits on the car seat. Have you ever seen this? You sit it on the car seat and it swivels. So when the person gets out of the wheelchair, they back their butt up to the car seat, sit down, and it swivels them so that you can get their legs into the front seat of the car. Cool little thing. So,
Where do you get that?
Carol Wright catalog, I just order them. Some places like medical supply houses also sell them. But the ones that I got out of the catalog. And it was just this little unsolicited catalog I got. Okay, some more things about nausea. Rather than have people think about food, maybe distract them. Plug them into the tube or radio. Do something that gets their mind off thinking about themselves. Low-fat food as opposed to high-fat food. If you're nauseated, you're probably not going to break down the fat. That's the hardest one to deal with. And if you really don't want to see that food, go with low-fat. Okay? Clear liquids as opposed to what they call full liquids. Clear liquids are anything you can see through. Now, you can see through vodka and beer. But that is not on the clear liquid diet, okay? So despite the fact that they might ask for a Coors when they're nauseated, let them know that the alcohol will probably tip them over into the V zone, and you'd really like them to stick with the ginger ale or cranberry juice or 7-Up or something for a while. Ginger is a really good antidote for nausea. So ginger tea, and that's taking some ginger root, slicing it up, boiling it in water. And that's why we had ginger ale up here, ginger sprinkled on something else they're eating with some fruit. And nutmeg is also very soothing to the stomach. So those are things you can put on food that'll help. And of course, when you worry is when somebody stays nauseated for continuously 24 hours, and they're only on liquids for 2 days. You know, something else needs to be done here. Okay, they've actually thrown up now. So you need a basin. Now, normally, what's called an emesis basin are those cute little kidney basins that they give you in the hospital. And I'm sorry, if someone is seriously throwing up, what happens is that it shoots right out the other side of the emesis basin. So the emesis basin is a trinket box. Okay, just put that somewhere and keep their jewelry in it or whatever. This is a serious basin, okay? And you can get dishwashing pans or whatever from, you know, Super Kmart, but this is serious. And for some people, they might need 2 or 3 of these, because a lot of times when the person throws up, so does the caregiver. You know, there's some things that you just don't have a stomach for, so it's one for them and one for you. I mean, and let's be realistic about some of the things we're going to deal with, you know? And when, of course, somebody is sick into this little basin, we're bussing this into the bathroom. It's nice to have another one to kind of put in front of them while you're gone, because the whole point of the basin is to try and have them not go all over the bed or all over the floor. So give them something in case there's a little surprise there, because they'll tell you, I'm feeling fine, and then you hear them as you're halfway down the hall, because they weren't quite done. So have supplies, okay? And then when you get in there, you got to look at it. I hate to tell you this, but you got to look at it. How much is there? Because that tells you kind of how much fluid have they lost. Are there pills in it? What color is it? What would you think if it looked like wet coffee grounds? Blood. Blood is protein. Anybody bleeding into the stomach digests it down like it does any other protein. And the form you get it back in is it looks just like wet coffee grounds floating in liquid. And that's their bleeding in the stomach. 911, do not pass go, do not collect $200. They have to be seen at the emergency room. They're actively bleeding in their stomach. And it can be something as, you know, they took their prednisone for 3 days without food. They're taking ibuprofen without food in their stomach, and they've got an ulcer. But that's a serious one. And taking care of their mouth afterwards. Getting that mouth clean afterwards, most of us, if you've ever, okay, everybody how many in this room have thrown up ever? Okay, remember how that tastes? That horrible residue in your mouth? And you drink water and you do all this stuff and it just doesn't cut it, okay? You know what cuts it? Antacids. It's acid in your mouth. Pop a Tums. Suck on it. Neutralize the acid and then swallow that to neutralize the acid that's all the way down the esophagus. That's probably burning, okay? Take an antacid. The other thing that the acid does when it's coating the teeth and the mouth is it's eroding the enamel of your teeth. So you need to get the mouth cleaned out. And that taste can precipitate the next episode of vomiting. So cleaning the mouth out afterwards is really important. Little bit of non-alcohol mouthwash. And now this is a concept that really is reserved a lot for people who are on cancer therapy. Because it's just kind of a given that there's certain chemotherapy that is, you take it and it's insta-barf later. So we came up with this concept called two-way foods. Things that taste pretty much the same coming back up as they do going down so that the vomiting is not so unpleasant. Only nurses could think of these kinds of things. So some two-way foods, ginger ale. We're back to these Tums things. Now we don't want to load people up with Tums. Don't get me wrong, they have their role. But after somebody throws up the Tums, the next time they throw up, amazingly, it's not as acid as it was last time. So this is kind of after every throw up, you do a Tums. Chocolate. It's good to know that chocolate's good both ways. Popsicles, Jell-O, and mashed potatoes.
And apricot nectar.
Apricot nectar, thank you very much. We're adding apricot nectar to the list of two-way foods. So if you know somebody's going to throw up in a while and they want something to eat afterwards, throw them a Hershey bar, you know, give them a popsicle, and then have the Tums at the bedside. When somebody's throwing up, obviously you want them in a sitting up position or on their side so that they don't somehow get this stuff aspirating back down into their lungs. So you want them, you know, if they're going to throw up, they're sitting forward and this stuff is all going one way out. And of course, medications to reduce it. And if people are really actively vomiting, a pill is not going to cut it. So probably, and doctors are always, they've been vomiting, they can't keep anything down, and they order another pill that you know you're going to see in this basin when you bus it next time. And you got to remind them, no, we need a suppository here. You know, we need this going in by a route that we know they'll absorb the medicine. So a rectal suppository might be a suggestion here. And when you worry, throwing up 3 times an hour for 3 hours, that's a lot of fluids and electrolytes that people are burning up. If they have changes in their mental state, because when they get dehydrated, they have that delirium we talked about, that instantly kind of losing it. An increase in stomach pain. Now there's a certain amount of aching after vomiting that goes with the muscles from projecting it. But if it's an acute, sharp stomach pain, that's not good. That means something else. Obviously the coffee ground vomit and shortness of breath. Did they aspirate some vomit when they threw up? And if they're weak or dizzy, which just is another symptom that they've lost too much fluid. Diarrhea. Notice how we did this in brown. My helper was so good to think of doing the diarrhea heading in brown. What a woman. Fluids. Lots and lots and lots of fluids. I mean, you're handing them a glass of something to drink as they're sitting on the commode. Whey people. We want to see how much fluid they've lost. You know, and the first 5 pounds that anybody loses or gains ever when they're dieting or whatever is water. So their body weight is the way to assess really large quantities that they're losing. Some strategies for helping to control diarrhea. Now, anything that's a new symptom, any of these things I talk about that's a new symptom needs to be reported to the physician and some kind of investigation be ongoing while we're helping to relieve them and make them more comfortable having these symptoms. So when we're thinking about, okay, they've got diarrhea, what are foods that we can add to their diet that will help maybe give this form to this stool so that they have some bowel control and not constantly sitting on the porcelain receptacle? And the acronym for some foods that have some binding properties are BRAT: bananas, rice, applesauce, tea, and toast. Bananas have kaolin in them. Apples have pectin, organic kale pectate. There we go. The rice, not necessarily the grains of rice, but if you put some rice in a pot, lots of water, and you boil the bejesus out of that rice, and then you give them the water to drink, it's really good for helping to get control of diarrhea. Another thing that I really like is baby rice cereal mixed into their other foods like scrambled eggs, mashed potatoes, things like that. It's also a binder and a thickener and will help control the diarrhea. Yeah.
What about now they have rice milk?
Yeah, rice milk is the same thing
Same thing?
as the rice boiled in the water.
That's pretty much,
Yeah, and you throw away the rice and you drink the water.
okay. So
Rice milk is great.
So rather than boiling for a while,
You could buy
go
rice
out and
milk.
buy a
Mhm.
rice milk.
Right. But for people where money is an issue, you boil a lot of rice.
Avoid milk.
Well,
Rice is, it's a term because it's white, but rice milk only means the water off boiled rice. There's no milk in it. It's milky color. Okay? And under the applesauce, it's not juice, because juice will actually aggravate diarrhea, but it's the apple itself, or jams or jellies, because it's the pectin in the apple. So you can actually buy little things of pectin at the market, like if you're canning jams and jellies, and add pectin to somebody's food to thicken the stool and give them bowel control. And of course, tea minus caffeine, and toast, you know, the binding ability of starch. And avoid bran, milk and dairy, hot spicy stuff, alcohol, and caffeine, because those are all bowel stimulants. And when to worry, black bowel movement. What does black bowel movement mean? That's right, blood. And it's black and tarry. That's real, you know, not just black, because sometimes people take iron and their stool will get really, really dark. But with iron, their stool gets really dark and really dry. And when it's blood, it gets this consistency of tar, and it has this very metallic smell to it. It's very characteristic. You can't miss it. Bowel movement 6 times a day for more than 24 hours. Thin, watery bowel movements is really diarrhea. Changes in mental state, that loss of 5 pounds over like a day or so. Increase in stomach pain. Now, dark pee or no pee in 12 hours, that means they're losing so much fluid that they're not making urine. Okay? That's dangerous. They're losing so much fluid out of it from this diarrhea that their urinary output is cut back. Danger sign. A fever that won't come down because they're dehydrated and they can't take liquids. For some reason, they just can't take them or keep them down. Well, we got good old dehydration here. Now, one of the things I'm going to say about dehydration is it's like a car. You know, our car runs out of water, it overheats. We run out of water, we overheat. We're just like our car. And this mimics so many other illnesses, and yet it's an underlying problem that takes people to the emergency room more times than about anything else that happens to them. And in older people who eating and drinking, I mean, most of us do not drink enough water anyway. And the older we get, it seems the less we drink. Keeping people hydrated is really important. Fluids available to them all the time. except, of course, if they have one of those fluid-restricted conditions. And then that's another ball game. But in general, that's not going to be the greater percentage of people that you take care of. This is just a rehydration mix. This is like homemade Gatorade. I wouldn't really recommend giving this to someone unless you know what their salt, they were not on a salt restriction, but it is a recipe. If some doctor says Gatorade would be good for this person and they don't have a lot of money to be going out and buying commercial Gatorade, this is a way to fix something up for them that works. And it's all the same when to worry stuff. Okay, good old constipation. We talked about that earlier. Keeping track of when people have bowel movements. They shouldn't go more than 3 days. What's normal for them? We don't want to, people didn't, let's say this person doesn't go all their life. They've gone once every 3 days anyway. And all of a sudden somebody decides if you're not going every day, we're going to start putting you on laxatives. You got to go by what's normal for them, what's their pattern. And what time of day do they normally go? And assess things that way. There's lots of reasons. Diet, inactivity, low fluid intake, medications people are on can cause constipation. Fruit and prunes. This is where the green apples are really good. You know, you want to slow everything down, you give them red apples. You want to speed things up, you give them green apples. Prunes. You love my little prune here. That's so cute. Liquids. Apple juice, real good for moving stuff through. Warm prune juice. You want to accelerate what these prunes will do? Warm up the prune juice. This is where you're throwing the caffeine at them, you know. And lots of water. Sugarless candy and gum. Sorbitol is a laxative. So for your diabetics who are on sugarless stuff, they might be going all the time. Actually, some of them who have lots of sugarless candy and stuff, they might be experiencing a little bit of diarrhea, and it's just because they're having so much sorbitol in their diet because of their sugar restriction for their diabetes. That's happened more than once, and people have just gone, oh, really? Exercise, best thing you can do, keep things moving. And then the last, absolutely, if you can't avoid it, laxatives and enemas. But it's real easy for people with this bad muscle tone to all of a sudden get dependent on laxatives and enemas for their bowel care. And that's really not healthy for them in the long run. And then when to worry. If they haven't had a bowel movement for more than 3 days, you got to have some backup plan. If they're bloated, they have belly pain, and particularly if they start throwing up, you know, something's blocking in there. Something that can be a little bit of a red herring here is that some people will be constipated, but they'll have this dribbling of liquid stool. That some people think because it's liquid BM, it's diarrhea. But what's happened is that they've got this horrible plug of stool there, and the more liquid stuff from up above is seeping around it. So if they haven't gone for several days and they begin to have seepage of liquid stool, they actually have a bowel impaction. And that probably needs to be dealt with at the hospital. Probably will need to be removed, and they will really not feel good. You with me so far? I haven't heard any snoring. I'm proud of you guys. Okay, we got some mouth care stuff here to talk about. And I have my mouth care little handy dandy kit. Okay, not much saliva. We talked about that whole dry mouth thing. And there's little products here. This stuff is some tablets that people can put in their mouth that dissolve and make like an artificial saliva that is a consistency that will actually stick to the tissue of the mouth as opposed to water, which is gone like that. So that's one brand. And then there's this stuff that you can spray in the mouth. That's another artificial saliva product. What else have we got here? We have these oral swab sticks, which is just a saliva product on swab sticks for cleaning out the mouth. Now, notice this does not say lemon glycerin swabs. if someone has a chronic saliva-depleted mouth, do not use lemon glycerin swabs. They actually dry the tissue out more and just create the need for more of the swabs. They're for people coming out of surgery whose saliva production is going to return to normal fairly quickly and who are going to be taking lots of liquids and what have you fairly soon. You want to stay away from that product for people who have actually a saliva production problem and a chronic dry mouth, because they're not the best. They taste good and people love them, but they aggravate the problem. Okay, some other things. Sugarless candy, because obviously if they're not making enough saliva, sugar sitting in there would not have the saliva to offset the bacterial action and can cause like tooth decay and gum disease and what have you. So sugarless gum and sugarless candy. And sugarless lemon drops. The lemon does something to stimulate some saliva production. You know, suck on a lemon sometime and see what happens to your salivary glands. Ice chips and lots of water. Frozen grapes. Take some grapes, lay them out on a cookie sheet and freeze them and then have people suck on them. They're very soothing and helpful. And then popsicles and Jell-O. You want to stay away from real acid stuff, high sugar stuff, things that might be crunchy. What I don't have on here is potato chips. You need to stay away from potato chips, and they're probably too dry if they don't have enough saliva in their mouth anyway. People should see the dentist a minimum of 4 times a year. And if they're having this acute saliva production problem, they might need to see a dentist like real soon and have this dentist maybe put them on a protocol for some things that will help out their mouth. Most people go to the doctor and complain about it, and doctors are not the specialist in mouth care. They need to see their dentist. And most people don't do that because insurance doesn't pay dental. But if they have a dental plan, they should do that. And then there's other, this Biotine company makes non-alcohol based. This is a mouthwash, and then they have a toothpaste, and they even have a chewing gum, and they've got, what else do they got here? An artificial saliva. You can get these wonderful little whole kits from the drugstore. They have all of those kind of products. If someone has a particularly sore mouth, Toothettes, you've seen Toothettes? Little sponge on a stick, and you can use it to clean their gums and stuff when a toothbrush is really too painful. I have a gazillion Toothettes. I don't know how this happened, but I just kind of collect Toothettes here. For basic care, dental care, soft toothbrush. And even if a soft toothbrush feels too stiff to them, soak it in hot water for a while. Make the bristles real soft. And then use the non-alcohol based toothpaste, you know, like one of the Biotine products for cleaning the teeth, if they can tolerate it. And everybody should floss. You know, it's just really important. It's part of preventing the decay in between the teeth and getting the food particles out. And that's just something that if they haven't been doing it, we really ought to encourage people to do. Flossing and brushing. Now, if people have a sore mouth, so a couple of things that they can do that they can make at home is you can take half-strength peroxide and half-strength water and rinse your mouth out with it. And then you follow that, and you can do that as many times a day as you want to. Spit it out, and then follow this rinse with just plain water. You don't want to leave a residue of hydrogen peroxide in the mouth. Or, if they can tolerate it, something that will also kind of keep the bacteria count low in the mouth is like a teaspoon of salt to 8 ounces of warm water and doing salt water rinses. But sometimes if their mouth is pretty sore, that salt in an open wound can be, you know, give them a little ugly rush. And you want to ask them about bleeding gums. If you know, brush your teeth or something, do they just bleed real easily? If the mouth is staying red for more than a couple days, and if they have any sores or cuts in their mouth, they need to go see somebody and get that taken care of. Oh, they don't sleep. Any of you have someone who's doing live-in? And does that person have a place, a family home when they're not doing the live-in?
Oh, no.
Okay, so they're living in and this is their room and board.
Right.
I just have to share with you something that came to me over the internet the other day, and I wanted to make sure I brought it up. A woman, the person that she was caring for died, and the family wanted her out of the house the next day. She had nowhere to go, no money to move, and found herself with absolutely no recourse because the room and board was part of her pay. She was no longer doing the work, and suddenly there was no provision for her for what she was going to do about housing once this person suddenly died. So, and there's not rent control protection because it's not a landlord-tenant relationship under the law. So people who are in those arrangements, what happens when the person dies clause at the end of whatever this tenure is might be something to think about, because she was on the street with nothing and no recourse, bunking in with friends until she could find a place to stay. So it's just something to think about when people are doing live-in stuff, is what's going to happen if the person suddenly dies, or if their services can continue for a month in cleaning out the house or helping settle things in exchange for this room and board while they get on their feet. But I had never been confronted with that issue before, and know several people who are doing live-in for their room and board and could find themselves sitting on the curb with their stuff, adding to the homeless population. And she had no immediate placement for another job. So it's just something to think about as agreements with people of what's going to happen if. So I thought I would bring that up, and insomnia for some reason triggered that in me. I don't know how I get these little thoughts, you know? What can be the cause of it? Well, people may be napping all day, so they're up all night. It could be medication, you know, that makes them. Prednisone is classic for people who can't sleep. It's not only PMS in the bottle and eat a hole through the refrigerator door, but they're just up and running all the time. Depression, and particularly depression when they've gotten news that something new or different is wrong with them, and suddenly everything dies down from the activity of the day, and they're sitting there at night and they're finally getting a chance to ruminate about what's going on with them. And it's part of the coping process, but it does keep them awake at night. And if there's somebody to talk to, this will really help change this. And are they in pain? You know, that's one of the other reasons. If some people are having trouble getting to sleep at night, exercise. If they're sedentary, it may be that they're not doing enough during the day to get physically tired enough to fall asleep. So we're back to sit and stay fit, okay? Get them doing something, moving their long muscles. I don't care if you have them lifting little weights or tying little sacks of rice to their ankles and having them do leg lifts. You know, maybe you better not be caught tying them to anything. But it's the idea of getting them to use their large muscles so that they get tired enough to fall asleep at night. If you can reduce the nap thing, now I don't know how you're going to do that short of they start nodding out and you pull them out of a chair, which is really not highly recommended. But getting them to try and stay awake, or reducing the number of naps or the length of time they sleep. Getting them involved in more activities. Keep them stimulated and busy. Easier said than done. The routine. When it is bedtime, don't let them lay in bed all day. They have to get out of bed and go in the living room. I don't care if they're slumped in a lump on the couch, but they're not in bed. And they go to bed at a certain time every night with the idea of going to sleep. Okay, that's one thing that helps. Valerian tea. Now, valerian is good stuff to make you fall asleep if you can stomach the smell. It really has a very distinctive, moldy kind of smell to it, and some people don't like to take it even in the capsules. But it is kind of a good sedative. Kava kava is another thing that'll work. That's some of those over-the-counter herbal remedies that people use from different cultures, and some people like melatonin. Suggestions for people to try. A light snack. You know, that high-carb, postprandial thing that you all are suffering right this minute? You've eaten carbs and blood shunts to your stomach and your brain is just... So you can take advantage of postprandial lethargy to get them sleepy to go to sleep at night. A warm bath can help, not hot. Hot will stimulate them. So a warm bath is what will help. Massage. And I don't mean massage like The back massages we give where we go from the butt to the shoulders, we kind of do this effleurage thing with the back. Nurses do it all the time in the hospital. And I think we do that because that's the end of the bed or this part of the bed where there's not all this equipment, so you can really get to people from going from their butt to their shoulders. But according to acupuncture theory, the stimulating meridians of the body are the ones that go upward from the ground toward the head. So when you rub somebody in an upward motion, be it from the wrists to the shoulders, butt to the head, from the heels up to the thighs, those are all stimulating meridians designed to wake somebody up. So if you're massaging somebody, shoulders to butt, shoulders to wrists, hips to feet, downward strokes are the sedating meridians to help somebody fall asleep. Now you're wondering, what's this cut onion thing? I can see it. Little question marks. You take any kind of onion, your favorite kind of onion, chop it up, put it in a glass jar, put a lid on it, keep it in the fridge. Can't fall asleep, you take the onion jar out, you take the lid off, you take a big sniff out of this jar, slap the lid back on, and you'll be drowsy in a few minutes and you will go in and probably go to sleep for 4 to 6 hours. There is something in the onion gas that is a sedative without having to take another pill. Really works. Don't ask me how. Don't ask me why.
Without trying.
You know, you're going to be surprised. It's not like cutting an onion for a salad. It's very sweet. It's very subtle. It's not unpleasant at all. It's a whole nother. Now, when it starts looking like a science project, you need a new onion. Okay? We don't want people inhaling things like mold and mildew. You want kind of a nice looking onion in that jar at all times. Okay? But it beats adding a sleeping pill to this mix. You know, and if it doesn't work, what are you out? An onion and you reuse the jar for something else.
About milk and whiskey.
For the jar?
No, drink.
Okay, we have a question here about milk and whiskey. Milk, yes. Whiskey, in the short term, that'll put him to sleep. It takes a lot of whiskey in the short term to put him to sleep. But there's something about alcohol. When alcohol starts to wear off and you break it down, everything that, all the nerves that it sedated, actually when they wake up are overstimulated, and that's why people, when they kind of are after drinking, they get this. And they'll wake up in the middle of the night with their heart racing and jittery from alcohol. It's actually the worst sleep aid.
There are some people that use 10% whiskey and 90% milk and mix them together.
You know, and if it works, so we've got what, 10% whiskey and 90%
Yeah,
milk?
that's what the
1 to
English
10
people
solution?
does.
Well, you know, I'm going to start trying that. We have a new recipe here. And you know, another one under the constipation. When I went to work at this little hospital out in the backwoods of Oregon, and I had this doctor come in when I had this woman who was really constipated. She hadn't gone for a long time, and he wrote this order for a milk and molasses enema. And I'm looking at this thing and I'm going, oh, what are we making here, cookies? I mean, what is this? But honest to God, 4 ounces milk, 4 ounces of molasses, warm it up, run it in, and bingo, we have no more problem here. So we've got whiskey and milk for sleep. You drink that. And then we have the milk and molasses enema. You infuse that up the rectum. We just have all kinds of great things here. It probably works. I'm not going to say a whole lot about deep vein thrombosis, except if you have people who are sedentary, they're probably prone to blood clots of the lower legs. And there is a rule that you never massage anybody's legs. Okay? And if they say they've got a pain or a cramp, for cramps, if it's truly a cramp, you will stand them up, you will get them to rock forward on their feet, or you pull their leg out and you pull the toe toward their nose and stretch out the muscles back here, but you never massage anybody's legs because a blood clot in the legs will feel the same as a cramp. And if you massage those legs and somehow dislodge that clot and it decides to get in the circulation and move, it can go to their lung, it can go to their heart, it can go to their brain. And if it doesn't kill them, it can make them very, very sick. So we don't do any massaging of legs. You can massage people's feet. Don't massage their calves. Don't massage their thighs. Just don't do it. And when they're complaining of pain in their legs, they need to see the doctor about it. And if they're having lots of cramping, there's medicines that they can give them. Cramps in the legs happen a lot for people who have certain heart conditions because of lack of oxygen and all kinds of things with chemicals, and they need some quinine pills and calcium supplements and all kinds of stuff. And then depending on how it's diagnosed with whatever this pain is in their legs, they will come home with some kind of protocol people need to follow about their at-home care. But if you suspect for a minute that they've got a clot, don't let them walk. They need to be transported by ambulance to the emergency room. Nobody wants them standing on that foot and having any muscle activity dislodging that clot and putting it into the general circulation and getting it to move. So we just get concerned about that. Now, once they've had one of these and they've cleared it up and come home, they'll probably be on that anti-blood clot medication, Coumadin, or they'll be on aspirin, something that's quote unquote a blood thinner. So then you have to watch them for potential bleeding. Okay, skin care, really, really important. We'll put all this little tooth stuff away. Now, taking care of people's skin, that's a pretty important thing to do. Obviously, if they have any sores, cuts, abrasions, we talked earlier about if you put a Band-Aid on that, are you going to rip more skin away when that adhesive comes off? And so I'm not a big fan of Band-Aids. People should have in their medicine cabinet some sort of topical antiseptic ointment. Any wound that they get should be washed very gently with soap and warm water. Pat it dry, get it really good and dry. And then if their skin is very, very fragile, you go ahead and you put whatever the ointment is on it. And then I'm a big fan of having rolls of sterile gauze around. And literally roll the gauze all the way around the limb, okay? And then use paper tape, which we have some handy dandy, and it's paper with stickum on it, and just use the tape gauze to gauze. Now, if ever you put some kind of let's say there's a little dressing, you're at a place where, you've got something on their trunk that really you're not going to be wrapping gauze all the way around their body. The good thing, the beauty of paper tape is that rather than peel it off, get it soaking wet, and it will just fall off. So that's kind of the beauty of paper tape. Very few people are allergic to paper tape, so that's a good one. But it can be the thing to use with a little gauze pad, and always put something on the wound that will make it so that the gauze doesn't stick to a scab when you're going to remove that dressing. And of course, once again, you can always get something soaking wet and then slowly remove it. I think what we get into is when we hear, well, we've got to change somebody's bandage, and we think we've got to do it in 22 seconds or less. And sometimes it's going to take us an hour to keep wetting something before it will really fall away without taking their skin off. But it's thinking about, these kinds of ways, these strategies to put a Band-Aid on somebody. People have lots of chronic itching. That needs to be looked into. I mean, some people get scabies. They get scabies from the linen in the hospital. And it's really underdiagnosed. So if they got itching, and especially if they're saying it's keeping them awake at night, yellow skin, they're building up bilirubin in their skin. They might have something going on with their gallbladder, their liver, maybe pancreatitis. And you may not notice it too much, but where you might notice that they've got this buildup of yellow is look at the whites of their eyes. And if the whites of their eyes are getting yellow, and that'll make them real itchy too. And then the kind of soap that you use on their skin. It should be really, really mild soap. Dove, again, is one of the better ones because it's pretty well acid-base balanced, not a lot of alkali in it, and most soaps out there are really very alkaline. Ivory is one of the worst, and I hate to say it, 99.99% pure lie. and it really does alter the pH of the skin. So you want moisturizing soaps, and actually there's a whole battery of therapeutic soaps out there. Somebody has hives, pay attention, that's an allergic reaction to something. And another thing we want to talk about is what kind of lotions to use on people's skin. We're just going to assume their skin is dry. Well, you start with hydrating them, drinking lots of fluids, but the other piece of this is when they're done bathing or what have you, putting lotion on their skin. And I'm not a big fan of most of the commercial lotions because if you look on the back, they all have alcohol SD40. And this alcohol takes off the stuff from the surface so their skin doesn't feel sticky. And yet what they really need is a good emollient, oil-based lotion on their skin. When somebody's bathing, a nice thing to do is take the lotion and float it in the tub while they're bathing, because then it'll warm up with the hot water, and then when you put the lotion on their skin, it'll be warm, which is always pleasant. Take a hot bath and somebody slaps cold lotion on you. That's just an unkind thing to do. But lots of lotion on the skin. Sometimes, if you're doing sponge baths, putting lotion in the water and actually applying it mixed with the water on their skin can be real helpful. And for a lot of these people, they don't need to necessarily be soaped every time they're bathed. They're not really dirty. Sometimes in the shower, water running over most of them and you're hitting the hot spots with soap and water would be all you need to do. And just taking a wash rag and kind of rubbing down and exfoliating the skin off their back and the skin off their legs without necessarily using any more soap, and then lotioning the hell out of them when they're done. And Eucerin and Nivea and Cetaphil and some of those therapeutic lotions are really wonderful on older skin. They're just the best. Let's see, I think I've run out of little cartoons here. Does anybody have any kind of particular questions? Okay, that's good. I want to talk a minute about fainting. Usually happens when someone gets up too fast or their heart rate's too slow. And when we faint, we fall on the floor and we get level, and then the heart can get the blood to the brain again. It's actually a compensating mechanism to fall down. So, of course, we don't want people to fall down, but if we're getting someone from a lying down to a sitting up position, stand with them for a few minutes. And you do it in stages. First, you get them sitting up. You wait till they equalize, then you stand them up, and then you wait again till they equalize, standing there with them. Because otherwise, they'll just do thunk. But people who faint, if that's not something they've done before, you got to report that, because that could actually be something with their heart rate. Their heart rate could be too slow. This might be signaling something that can be treated. A seizure. People don't normally have seizures. If they have a seizure, it's a 911. Just know that. We don't put anything between their teeth anymore. That's not done. You call for help. You watch what parts of their body are seizing. You time how long it lasted. And when the seizure stops and it looks like they're starting to wake up, you quickly roll them to their side so any secretions that are pulled in the mouth can roll out the mouth onto the floor, and they don't, when they take their first breath, inhale in blood and saliva and stuff if they've bit their tongue. And we don't worry about whether they're not breathing, because during a seizure the diaphragm freezes and they're not breathing. Seizures only last about 1.5 to 2 minutes, maybe 2.5 minutes. It'll be the longest 2.5 minutes of your life. But it's not long enough for brain damage to happen. And they're not breathing anyway, so we don't need to open any airway while they're doing this. Leave them alone. Don't constrain their movements in any way. You will only dislocate something. Watch them, time it. What you see will be telling the people who are picking them up what parts of the brain were affected by the tonic and clonic movements and which part of the body were involved. So be really astute observers, report this, and then let the medical crew figure out the diagnosis and what's going to be the treatment. But most people, if they have a seizure, it usually signals there's something weird going on in their head and it's not good, and it's an emergency, period. Now, if a person has a history of a seizure disorder, then they have probably been on seizure medication. They will get a seizure that breaks through once in a while. They have a protocol there that they will let you know, I have seizures. And still, the same old thing, time it, observe it, roll them on their side when it's over with. They'll be tired, they'll have a headache, put them to bed, and then just kind of hang around for a while. And it doesn't hurt to log it on the calendar and call the doctor and say they just had a seizure. And they can note that, and then they'll let them know what they want to do. Shortness of breath is never okay. Somebody who can't breathe, I'm sorry, lack of oxygen is a 911 to me. You sit them upright, you stay as calm as possible, you get them to pace their breathing, and you get somebody there who can take them for help. You don't have oxygen there, even if you do, and they're still gasping, we don't mess with shortness of breath. Err on the side of safety. That's an emergency. Human beings do not do well without oxygen, period. The last thing I want to talk about is people with peripheral neuropathy or numbness and tingling in the extremities. And what you have to be careful with that is that it makes their grips difficult. They can't hold things the way they used to. They might need adaptive grips on their forks, their knives, their toothbrushes. Their dishware may need to be different. And where they walk, if their feet are numb, they don't feel the ground under them. So you get throw rugs out of the way because they can trip and fall. So if someone has numbness and tingling, hands and feet, those are kinds of things where you're being really vigilant and just try and imagine what it's like to not feel the ground under you. And if they're chopping and getting food ready, they can cut themselves and not feel it. And bleed for a while and not even realize that they hurt themselves. So that's just some of the things that when you're in the home you're real vigilant for, and you're doing their cutting and chopping in advance. You know, what do you want for dinner? Do you need me to cut it all up for you? Any questions about that? Okay, once again, time to move your butt. Thank you.